America is not prepared, and nurses are not being protected. I quit my job today. I went into work and I was assigned to a COVID patient on an ICU unit that has been converted to a designated COVID unit. None of the nurses are wearing masks, not even surgical masks, in the hallways when they're giving report to each other. I had my own N95 mask. I told my manager I understand we're short on supplies, but let me protect myself. Let me feel safe. I have family that I have to come home to, and the way things are looking, this isn't gonna get any better. America is not prepared, and nurses are not being protected.
The coronavirus continues to spread in the U.S., with over 1 million confirmed cases. As the epidemic continues, one of the biggest issues has been a lack of medical supplies, especially the personal protective equipment known as PPE that doctors and nurses need to keep from getting infected while treating patients. PPE includes face shields, surgical gowns, disposable gloves, and most important, face masks, both regular surgical masks and special N95 respirator masks that offer more protection against the coronavirus. The mask shortage is so bad that hospitals are asking their healthcare workers to reuse masks that are designed to be used only once. And now, the U.S. Centers for Disease Control is recommending ordinary people wear masks too, but cloth ones, because we don't even have enough medical-grade masks for medical people.
What we're seeing with regard to the masks is that companies that were producing masks for the U.S. and other countries, those company manufacturers were ordered not to export masks because they were needed in China, and that's understandable. But this is a consequence of the global supply chain being concentrated in a single country. If there's an outbreak in other countries, where are the masks going to come from? This is why one of the recommendations in China RX is that we diversify our manufacturing base. And in some cases, we're going to have to each develop our own manufacturing capability, because if there's an outbreak in Europe or Canada or Australia now or in the future, each country is going to want to keep product for their own people, and that's perfectly understandable.
So when we look how we got here as a whole, to answer your question, Simone, the Chinese were very specific in a strategy where they knew we couldn't fully manufacture a complete product, which puts a bottleneck on the supply chain. And so by allowing these industries, the economics not to work, by allowing the Chinese to subsidize a product that we weren't actually subsidizing, we end up in the situation that we're in today. We have allowed this situation to happen. And I think it's very important to point out right now with, what's going on in the world and the outsourcing that we've done within, China as a whole. We look at what's happening with coronavirus right now. We look at the medicines that the Chinese control and what could happen if they were to cut us off. And this is, it's blanket across a lot of industries. And it's a very scary thing to realize how much time it takes to turn this around.
So why can't companies just make more masks? It takes time to ramp up production, hire and train more workers, or get more machines for manufacturing.
It's a shame. How can this happen again? That the richest country in the world is not able to protect his healthcare workers. Sending our healthcare workers against an invisible enemy, this coronavirus, without personal protection equipment, is the same like sending our troops with no guns and no knives into war. I would like to see the Marine who is going and faces an enemy with not having a gun in his hand.
Leaders in various offices, from the president to the head of health and hospitals, saying things like, we're going to be fine, everything's fine. And from our perspective, everything is not fine. I don't have the support that I need, and even just the materials that I need physically to take care of my patients. And it's America, and we're supposed to be a first world country.
How did we get in this situation? It's not the first time. Remember the swine flu or SARS? It's now all happened again.
Speaking of the 2009 swine flu outbreak, one of the big concerns during that pandemic was a shortage of surgical masks. Who saw that one coming? One of the biggest reasons for the mask shortage back in 2009 is the same as today: the global supply chain. As this paper on the swine flu mask shortage says, a significant proportion of the supply chain is produced offshore and might not be available to the U.S. market during an emergency because of export restrictions or nationalization of manufacturing facilities. When the coronavirus outbreak first started in China, China immediately stopped exporting face masks. They made more than half of the world's medical masks before the coronavirus hit. But why is the US running out of medical masks? Well, we're talking about it on America Uncovered, which means it's complicated.
Chris, it's not complicated. It's easy to blame the Chinese. But the ones we have to blame is ourselves. Greed. Corporate greed got us into this situation at the first place. And who will get us out of this situation? Sure not the large corporation. As soon it is a little bit over, they're back on what they're doing best, making money for the shareholders and foreign investors. I don't think I need at this point to go and talk about how the large US corporation killed the small US manufacturing businesses. There's plenty of information about this on the internet. But what we want to talk about is how we're going to make a change, how we can start right now to rebuild America, to rebuild American corporations, small businesses, and small manufacturing. Our dependencies on Chinese medication and medical equipment is unacceptable. The only people we can really rely on to solve the problem on long term are our small businesses. Small businesses have the advantage that they're flexible. They can respond much faster than large corporations. The problem is that there are not enough machines in America to produce enough PPE system for our market. Those machines are very expensive and are not easy to finance for small businesses. That is why the Tricentage team focus with this campaign on raising funds so we can purchase machines to produce PPE equipments. We will install these machines into the small business manufacturers that they can produce PPE system from now on and in the future. To accomplish our mission to provide PPE equipments to our healthcare workers in the field, we need your help. So we ask you to make donations and help us to raise these funds, and by distributing our message through your social network. Thank you very much for helping out during this crisis.